Hello, my name is Madison Maples, and I'm a part of the class HSC 6037 with Dr. Holly Moses. And I am very excited to share with you guys today my health philosophy. So, what is my philosophy statement? My philosophy statement is I strive to improve myself through health education opportunities so I can assist others in reaching their best health and wellness potential. And I'd like to discuss three things today that really go along with my philosophy. And the first one is my beliefs about the field of health education and promotion. Secondly, people and experiences that influence my beliefs and career trajectory, and my future role as a health education specialist. So, first up, my beliefs about the field of health education and promotion. One of my favorite quotes is by Nelson Mandela. Education is the most powerful weapon which you can use to change the world. I firmly believe that individuals cannot be expected to make a positive change in their lives if they are not given the knowledge and resources to do so. And this really puts a huge emphasis on the importance of education. I also firmly believe that teamwork is essential to health education and promotion. Teamwork brings many different unique perspectives and different ideas to the table. And although teaching and educating as an individual can be very effective, I do firmly believe that collaboration is the best way to reach that priority population, whomever and wherever that may be. Secondly, I'd like to share with you the people and experiences that have influenced my beliefs and career trajectory. The first person that has really influenced me is my dad, and he has taught me consistency, humor, hard work, just showing up and being there, integrity, generosity, sacrifice, and compassion. Secondly, my mom has taught me about values, persistence, kind heartedness, and spirituality. And thirdly, my husband has shown me a loving spirit, optimism, gentleness, perseverance, genuineness, and intelligence. Um, and then, as far as experiences that have influenced my career trajectory, have been my travels across the country. In Europe, I have been to France, Italy, Austria, and Germany. In Africa, I've been to the Republic of Congo, Ethiopia, Zambia, Zimbabwe, and South Africa. And in Central America, I've been to Haiti and Nicaragua. And my experiences in these third world countries have really had a huge impact on my choice to be a health education specialist. I have seen the absolute most absolute poverty, and these people. I mean, they're the happiest people you've ever seen, but it's so sad to see the lack of education and the lack of health resources they have. So seeing that and being able to help those people in whatever limited time I had, really pushed me in the direction towards service to others. These are some pictures of people who have influenced me. In the top left hand corner is my family. Top right hand is my husband and my babies, my dogs. And at the bottom, you have my family again, my siblings in the middle, then me and my mom and my sister in the lower right hand corner. Um, I also want to talk about my previous education, as this also really influenced my decision to become a health education specialist. I actually have two undergraduate degrees. The first one is a BS in health sciences, and then I have a BSN in nursing as well. And all throughout nursing school and as my first year as a nurse, I worked really heavily in tertiary care. So focusing on retraining, re-educating, and rehabilitating. Um, and we just saw so many sick people, and the focus was just to get them through another day and to alleviate their pain. And there really wasn't any focus on education. So what happened was a lot of the time I would see the same patients time and time again, returning to my unit because there was no one teaching them about prevention and how to keep themselves from ending up in the hospital time and time again. I realized that I was not content with just treating symptoms and caring for the immediate issue. So this began to spark a passion within me for primary care and patient education. And this is the hospital. It's actually the hospital I work at, Cox South in Springfield, Missouri. All right, and then thirdly, I would like to discuss my future role as a health education specialist. I am very passionate about women's health, children, and young adults. And actually, I'm working in a pediatric office, so it's pretty perfect for me. I also want to help single women and mothers take ownership of their health. Um, I would like to see a decline in drug use and dangerous behaviors among young adults. And then, kind of on the flip side, I'm also interested in pursuing a career as a lactation nurse consultant, which I think would probably be more of the end goal for me. So it's just some statistics I found that really show the immense need for lactation nurse consultants. And these statistics are from the CDC website, but 83.9% of infants are breastfed at some point in their early lives. 56.7% are still breastfed at 6 months of age, and only 35% continue to be breastfed at 1 year of age. So you can really see the decline in those statistics as the months go by. When the CDC surveyed to see why do mothers stop breastfeeding, some of the main concerns were issues with lactation and latching, concerns about infant nutrition and weight, unsupportive work policies and lack of parental leave, and cultural norms and lack of family support. Like I said earlier, I work in a pediatric office, and a lot of the phone calls I get are from mothers, and especially new mothers, who just have so many concerns about breastfeeding. No one's really taken the time to explain it to them and to educate them and help them to work through some of the issues with that. So that's something I would really like to do in my future, is to become that consultant that takes the time to educate and takes the time to work through issues. And how am I going to do all this? I am going to become competent in the 8 major responsibilities found in the HESPA 2020 model: assessment of needs and capacity, planning, implementation, evaluation and research, advocacy, communication, leadership and management, and ethics and professionalism. In conclusion, once again, my philosophy statement is that I strive to improve myself through health education and opportunities so I can assist others in reaching their best health and wellness potential. And today I discussed my beliefs about the field of health education and promotion, people and experiences that influence my beliefs and career trajectory, and my future role as a health education specialist. References? Right, you guys, thank you so much for listening. I would greatly appreciate any questions and or comments. I hope you guys enjoyed, and I look forward to hearing about your guys' health philosophy. Thank you.